today, let's talk nursing, let's talk NCLEX. It is going to be amazing. It is going to be amazing here. And this is Monday motivation. We got a lot going on today. We got a lot going on. All right. If it's your first time joining, hey, I'm Regina MSN, the #1 NCLEX instructor on this planet. I'm also the author of Quick Facts for NCLEX. It is the best-selling guide on Amazon. If you are in nursing school, check it out. The virtual trainer, I'm also the creator of the NCLEX virtual trainer. Guess what, guys? It is the future here already for ReMar. It is 2020. I'm waiting for you guys to catch up. It's time. It is time for us to get our nursing license. What do you want for this year? I have so much planned for you all. I'm just waiting. I'm just waiting for you guys to catch up here. It's all about the virtual trainer, the #1 NCLEX content that you can get. Good morning, good afternoon. You guys, you need to understand this. Listen. At the end of the day, at the end of this year, you want it to be different. You want to say, hey, I made it through the year with my nursing license. This is Let's Talk NCLEX Monday Motivation, all in one. We're talking med surge today. Let me just start out with how I love to start off, which is with a real ReMar testimonial, Hey, she says this. Some of you will be able to relate to this directly. After I failed my state boards, this is real ReMar talk right here. After I failed my state boards, I wrote on an index card, I will pass NCLEX, Michelle, RN, BSN, and Matthew 7:7-8. Ask and it shall be given. Seek and ye shall find. Knock and it shall be open to you. I was testing again soon and wanted to study so much more, but I gave it to God and wasn't going to, I don't know, I can't see the last line, but she says, I walked into the test center that I failed at the first time. So she went back to the same place. She says, I prayed in the car and again in the bathroom before taking my seat to test. I walked in repeating the scriptures in my head. Yes. I had my head held up high. I felt a decrease in my anxiety and an increase in my faith. I promise you, God handpicked my test for me. She says, I wasn't going to make a post, but somebody out there might be going through something and is close to giving up. You don't know what people go through. I want to show that when failures happen, pick yourself up and keep going. Everyone has felt the urge to quit. It may take twice as long to complete it, but don't listen to the naysayers. Keep going. I am proud to be a ReMar nurse. Michelle, RN, BSN. Oh, amazing. I'm just so proud of the ReMar nurses. And this is why, listen, I have to tell you guys today, I have a lot of surprises for you all. I wanted to tell you that it's the future and I'm waiting for you to be there with me, but we're paying for people's NCLEX today. We got a list of people we're paying for you to take NCLEX. Not only that, I know you guys want the virtual trainer. I know that you understand that this is the #1 resource for NCLEX content, for nursing content. We get messages about it. We get calls about it all day. And I put a post up on Instagram and Facebook over the weekend. And I simply students right now in the virtual trainer. What do I need to do to get you in the virtual trainer today? Like, what do I need to do? And the responses were simply, I want the virtual trainer. I want the virtual trainer, but I need a discount. I need a sale. And so Mark and I and Team ReMar, we were thinking, okay, what can we do? How can we get you guys into the virtual trainer? So I'm about to tell you the sale that you guys have been calling about all morning. I'm going to tell you, we are doing something that we've never done this before. It's like crazy. And I just want you guys to understand that we're stepping out on faith. and we want you to invest in yourself. I'm so tired of nursing students not passing NCLEX. I'm tired of you guys not having your license. I'm just tired. And in the future, I see you guys as already being victorious. I see you guys as already as Michelle is with your license. So this is what we're doing. The virtual trainer, the #1 most advanced NCLEX review. We are doing, are you guys ready? Are you guys ready for this? YouTube, Facebook, are you ready? All right. We are doing a bigger than Black Friday sale. All right. Check this out. All right. This is no questions asked. The virtual trainer will be $150 only. Okay, December 26th through January 3rd, the VT is going on sale. We are reducing the price bigger than the Black Friday sale. If you missed the Black Friday sale, guess what? The boat is coming back around. And it is better. Plus, we are giving 90 days access with this program. Wow. That's all I can say. This is the no excuses. This is the no questions asked. This is if you ever wanted the virtual trainer, whatever excuses you had, they're gone. They're dead. Like, this is the time. This is 2020 getting there. Like, we're not bringing any of the drama from 2019. We're not bringing any of the failures from 2019. We're not carrying them into the new year. We are only bringing in the good stuff. And I'm helping you guys to do this by this price. I mean, I don't know what more I can say about it. Hearts on the screen, $150 for the virtual trainer. Get on it. Wow. Yes. And you know what? We do have Let's Talk NCLEX, and I do have questions from the VT and listening to Warren Buffett. You guys know Warren Buffett. He's like the billionaire, mega rich, wealthy guy. And they asked him what was the most important investment he has made. And he said, I invested $100 into a program, and it taught me how to essentially make friends, right? It taught me how to be friends and make friends. He said, that was the most important investment I have ever made. And it was an investment in myself. And you guys know Warren Buffett owns companies and corporations and people's products and things like that. And he said the most important investment he ever made was in his self. I'm asking you guys, make the investment in yourself. You are. Everybody that's watching this has the potential to be just as rich as Warren Buffett, period. And it's really even not about the money, but it's just understanding your value. I read something today where a nursing student said, once I got my license, everything I had invested seemed like so little. So here we are literally giving you an opportunity to get this program. All right. And the sale starts the day after Christmas. Okay. The day after Christmas, you can get it. All right. So listen. And this is part of our 7 days of NCLEX. I'm also doing a review for 7 and going to be bringing you guys important lecture information, NCLEX study focusing. Like I'm just really excited to be able to spend this time with you. So if you didn't get a chance to catch the Black Friday sale, this is an opportunity for my ReMar nurses who really wanted to get the VT, right? Really wanted to get the VT and they didn't get an opportunity. So at the end of the year, we're doing a big blowout sale. And this is the way that we're just trying to encourage you guys. Don't go into 2020 with excuses, with doubt, with any kind of just hesitancy. Let's just do it when it comes to getting our NCLEX license, okay? So here we go. All right. Also, again, I mentioned it. We're paying for people to pass their NCLEX exam. We're paying for you to pass your NCLEX exam, and I will be revealing those. Names at the end of the broadcast, but these are the cities that students come from. So I'm really excited about that. One more time, One more time, remarnurse.com is the website where you can connect, find out any information that you want about ReMar, our products, what we offer. Also, no virtual trainer. All the questions come from it. All the questions come from it. And just to be clear, we really had no intentions of doing a huge sale like this. We've never done anything like this. So people, if you purchased during Black Friday or anything like that, I literally thought that was going to be the biggest sale for the virtual trainer. So what we're doing now is we are trying to really, really, really meet the students who did not have the money. They may have just purchased the ultimate package, or they're struggling nursing students. And so we wanted to meet them where they are. So I hope that we can encourage each other during this time. We can support our nursing students, because that's what this community is about. That's what this community is about. All right. So we're going to get right into the NCLEX questions. Here we go. The first question from the virtual trainer is this. All right. It says, a nurse is caring for a client with suspected diagnosis of brain cancer. Which of the following is the only diagnostic procedure that is a definitive diagnosis of cancer? Is it number 1, the MRI, 2, the biopsy, 3, the CT scan, or 4, a tumor marker? A tumor marker. What are we talking about? We're talking about what is the most definitive diagnosis for a client with cancer. Here are the choices. All right. MRI, biopsy, CT scan, or tumor marker. I see the answers coming in. Good job, guys. Good job. Right? Already, we're ready to go. This is Monday Motivation. Let's talk NCLEX. We're getting excited about studying for this exam. Correct answer, you guys got it. Easy peasy. We're talking about a biopsy. And the biopsy is the only definitive example, because it will actually identify those cancerous cells. It will actually identify those cancerous cells. Hey, let's go to question number 2. We're feeling good. We got the first one right. Question number 2 says this. A client has a platelet count of 55,000 and is diagnosed with thrombocytopenia. What's that? What would the nurse expect to see during an assessment? Is it number 1, nausea and fever, 2, weakness and fatigue, 3, bruising and petechiae, 4, dizziness and vomiting? Here we go. What is the correct answer for a client with thrombocytopenia? What do you guys think? Is it going to be number 1, fever and nausea, 2, weakness and fatigue, 3, bruising and petechiae, 4, dizziness and vomiting? Dizziness and the petechiae. The low platelet count will actually have this client showing signs of hemorrhaging or bleeding underneath the tissues. So you're going to have bruising there. The normal platelet count, just for a reference, is about 150,000 to 400,000. Next question, question number 3 says this. Deficiency syndrome for which most common symptoms? All right, I'm testing you guys here. Here we go. What are the most common symptoms here? Is it tremors and bradykinesia, 3, hematuria and abdominal pain, 3, headaches and bleeding gums, or 4, low-grade fever and persistent diarrhea? Here we are talking, this is content. This is identifying information, tasks associated with a subject area. You know what? I can't wait to do 7 days of NCLEX, because I'm going to tell you guys exactly what the secret is to knowing what is. AIDS are variable, but You talk about a low-grade fever and persistent diarrhea. That's going to be something that's commonly seen. That's going to be something that is commonly seen. Excellent. Excellent. I just put medical surgical nursing. You guys are doing very well in med surg. You guys are doing very well. Okay. Next question here. Medical surgical nursing. A client asked the nurse, how does glaucoma damage my eyesight? The nurse should explain to the client that chronic open angle glaucoma does what? Causes the retina to detach, will cause inflammation of the eye, or causes increased intraocular pressure, or will promote decreased blood flow to the retina. Which one is it going to be? We're talking virtual trainer, we're talking med surge. Wow, we're talking, listen. Voda says, I just passed my exam. I had a lot of questions on HIV and AIDS. I know, listen, I know you did. I'm trying to tell you guys, everything that I do is for a purpose. I've been doing this for 10 years, okay? I want you to pass your NCLEX exam. What is the correct answer here? What is glaucoma? What is glaucoma? What is the cause of it? What is going on with clients who have it? Okay. All right. I see the answers. If you have, let's see, I'm looking here. If you have quick facts, you know glaucoma is part of this book. You got to know it. You got to know it. Quick facts comes in because these med surg questions are strictly, what do you know about the subject? Okay. The correct answer, let me see what we have here. Choices. Go ahead, put the answer down, share this video. Okay. I see choices between 3 and 4. Yeah, we talking quick facts. I like that. The correct answer is number 3, leading to increased intraocular pressure. The increased pressure leads to the destruction of the nerve fibers, and that is what causes the vision loss. And that is what also is going to cause damage to the retina. Won't cause it to detach, but will cause damage. All right, that's because glaucoma is, if you're studying a lot of eye diseases and things like that, you may miss over glaucoma, but it's really important because NCLEX likes to ask you about the treatment for glaucoma, and they want you to be able to determine, let's see. All right. So just things about glaucoma from the Quick Facts book. All right. Things that you want to make sure you know. Because glaucoma is increased intraocular pressure of the eye, what you will have is like a progressive disease. Just like if you think about hypertension, how hypertension is called the silent killer, right? People don't know that they have hypertension and they're just walking around with it. And then all of a sudden, bam, they have a stroke, right? So with glaucoma, it could be that way. You can have this really insidious disease that you just live with. And if you're not getting, regular eye exams, you experience some vision loss and you're like, what happened to me? And you had glaucoma this whole time. So remember, there's 2 types of glaucoma. There's open angle and there's closed angle. Open angle and closed angle. And then how will the vision change? How will the vision change with a client who has glaucoma? Well, there'll be blurry vision and tunnel vision. So there'll also be halos around light. So people who have glaucoma, they have a difficult time driving at night. They have a difficult time because the car lights from the other cars are magnified and they have halos under them. So I'm just reading you guys quick facts. And so this is how I study with quick facts. This is how you can grab a friend to study with quick facts for you and essentially just ask you to talk about the topics that are in here. So, yep, glaucoma. What else? Also, if they ask, okay, so we know that you have increased fluid in the eye, increased fluid in the eye. So you would want to give an osmotic diuretic. That's going to help that patient. All right. And then what is it? All right. And then also the 2 types, you want to know the difference between miotics medication. All right. And mydriatic medication. All right. And so, yeah, so this is just like a quick way to study for glaucoma if you have quick facts for NCLEX. Perfect. Okay, let's do question number 5. Virtual trainer, question number 5. Oh, a client with thyroid cancer is being treated with radioactive iodine. The nurse should take precautions with which of the following major sources of contamination? All right, we're talking about radioactive iodine. The question is it going to be blood? Is it going to be urine? Is it going to be sputum? Or is it going to be feces? We're talking about radioactive iodine. Okay, we're talking about radioactive iodine. What is going to be one of the most major source of contamination? All right, come on in. This is Let's Talk NCLEX. We're doing med surg questions from the virtual trainer. I hope you guys are having a good time. This is fun to me. This is fun. I'm already anticipating 5 out of 5s all over the place. This is med surg nursing. Put your answer down, smash the heart button, smash the share button. Let everybody know it's time to study. It's time to study. ReMar nurses, your immediate attention is required here. All right, the correct answer. I love it. I love it. You guys are doing very well. The correct answer is going to be, yes, of course, it's urine. We're talking about radioactive iodine. Urine is the major source of contamination with this form of radioactive treatment, okay? So radioactive iodine. So nurses must be careful in handling urinals, bedpans, linen. All right, I want you guys to take some time and look up the precautions for a client who's getting radioactive iodine. Radioactive iodine. And this is basically safety for yourself, safety for other clients. This is what it's about, all right? I like it. People are putting up what they know. Share what you know about it already, all right? This is what we come together for. I call this a study group. Okay, so at the end of our 5 out of 5, did you get 5 out of 5? Veronique did, Mary did, good. And that's what you are making progress. You are. I wanted the questions to be from a topic that is largely seen on the NCLEX exam. That's these med surg topics, medical surgical. Whenever I go to a school or teach, the students say, hey, can you come back? Can you teach me med surg? You know, don't leave, like those kind of things. And medical surgical is one of those topics that there's a lot to know. There's a lot to know, but you guys have the foundations of it. And I'm really proud of you. I want to take you to the next level. I always want you to feel like I got it, but I want to get to the next level. And so the next level for us coming up is 7 days of NCLEX. That's our next big event. You got to sign up for it though. It's totally free, but you got to sign up for remarnurse.com/7 days. And these are the topics I'm going over. You're going to like it. I'm going to review pregnancy. I'm going to review TPN. I'm going to review psychiatric concepts. It's 7 days. I got a long time with you guys. You don't want to miss this. This is a live event. All right. Also, I'm going to do practice questions, quick facts, quizzes. I saw your comment. I saw your comment. You took NCLEX a couple days ago. You had questions on telehealth. I got you. I'm talking about telehealth. I'm talking about chest tubes. I'm talking about legal issues for nursing, child abuse. It's the future around here. I'm already in 2020. I'm just waiting on you guys. Telehealth nursing. After this review, there'll be no more questions asked about it. I don't want you to miss 7 days of NCLEX. And I'm kind of being silly, but I'm really serious because, listen, every day that you attend 7 days of NCLEX increases your chances of passing, all right? I don't want you guys to waste the gifts that we give you, all right? I don't want you guys to waste the gifts that we give you. And this is a place, somebody said those glasses. This is a place and this is a company where you guys have to understand why we do what we do, okay? Why we do what we do. I grew up I grew up I was put in a place where I was forced to do nursing. Not forced. I mean, I wanted to do it. I wanted to take care of my grandparents. I wanted to be their care providers, but I really did not know how to do it. I really didn't know. And it was a nurse. It was a home health nurse that took me, a 16-year-old girl, and showed me how to care for my grandparents, right? Showed me how to care for my grandparents. And she gave me this tremendous gift of free nursing education. Literally, I didn't have to go to a school. I didn't have to apply. This registered nurse put all of her knowledge into me. And so from that experience, I wanted to be a nurse. I wanted to give back. I wanted to show that no matter where you came from, what age you were, what country you were born in, you could do this nursing thing, right? You could do this nursing thing. And so here at ReMar, one of our core values is making nursing education easy for nursing students. You know, we could be like the other companies where it's just basically exchanging. We give you the product, you never hear from us again. Because that's how it is with most companies. When it comes to nursing education, you buy the book, you never speak to the author. You buy the product, you never see the creator. We wanted it to be so different and cut out any excuses that we have. So the 7 days at NCLEX is an opportunity for you to show up and take advantage of an opportunity. That's it. And that's the hardest thing, is just showing up. And I need you guys to understand that the road to success is built with many small steps, many small steps. All right. And I like this. I heard it at a Bible study one time, but it said the largest doors swing on small hinges. The largest doors swing on small hinges. And those small hinges are sacrifice and discipline. Okay. And so those things are required if you take this journey, especially with me. I tell you guys every Monday, you got to do it. You got to be disciplined. You got to sign up. So this is the event that we're having, 7 days of NCLEX. And these are the topics that we're going to talk about. Also, we are doing the no excuses, no questions asked. Don't email us. This is it. 7 days of NCLEX, Black Friday sale as well. Bigger than Black Friday. Bigger than Black Friday, December 26th through January 3rd, where the virtual trainer will be $150. That's $150. And this will be your opportunity to get into that program and get started. I'm doing this because I believe that this is the best program, hands down, for any nursing student out there. All right, that's it. And I don't really have anything more to say than 10 years of doing this. You learn a lot, you see a lot, you talk to a lot of people. So after Christmas, this is the time for you to give yourself that gift. Also, extended 90-day access. So when I say no excuses, it's really no excuses. All right. So I am going to proceed to give you what you need, which is Monday motivation. And so what I really liked about this too, let me go back just really quickly. I talk about the virtual trainer a lot, but what I really like is that we are getting so many contacts from schools, nursing instructors. You guys, if you follow me on Instagram or even LinkedIn, I was just at a school and I'm teaching classes, and instructors are messaging us saying, hey, we have 3 students in the virtual trainer. We're putting everybody in the virtual trainer. And so it's just so impactful when you can produce a product and people recognize that it's amazing. It's amazing. And you don't have to say it. So thank you guys, all of the supporters in the comments who say that they love VT. And if you want to check out some videos, you can go to our Facebook page. We have nursing students that are doing, the rebate, where they're doing the differences between the virtual trainer and our past package, which was the DVD program. So we no longer sell the DVD program, but many of you have it, and you have the VT as well. And you're just saying how you feel about the differences between the two. So if you want to check it out from ReMar nurses, check out those videos. They are really, really great. And I love getting them. All right. I love getting them. That's a fact. You can purchase the VT at remarnurse.com, but wait until the day after Christmas so you can get the sale. Okay. Just really quickly too, as well. Here is our Monday motivation topic. I'm going to advance. Here it is. my next baby, all right? And that's not my baby, that's your baby, all right? So I don't know what in the world. People are editing my slides, all right? So your next baby, all right? All right. How many of you would love to have this baby? How many of you, honestly, like how many of you are watching, the idea of having a baby is not a frightful thing, right? You see the little newborn and you see pictures of newborns. When you see babies, you just love them. You just love them. They're so cute and innocent and need so much attention. All right. When I see newborns, I like, it's a tenseful process for me. Okay. I'm the mother of two. When I see people with babies, I like them from afar. I don't want them. I like for you to be able to take your baby home with you. So, but well, you guys more so than me. This is about you. This is about you. Like, so, what you say? Arnero says, me, 3 kids. Nope, I have 2, right? You have to, you feel good. But actually, I wanted to introduce you guys to your other newborn. You guys have this baby in your life. Does anybody know what this baby represents? Does anybody know? And I want you to think, because I'm saying this for you guys, right? I'm saying this for you guys. Whose baby is this? In your life, what does this baby represent? Come on. And I know you guys usually track me and usually follow me. What is this baby representative in your life? All right. New beginning. Somebody says, I have no idea. Our future, our gift, our license. You guys are close. You guys are really close. Okay, so let me just tell you, this baby represents your nursing career. Yes, your nursing career is like a newborn baby. Right now, seriously. A baby. This is the adjective that I'm using because babies are comparatively small. They're immature. They're just, it's an adjective to mean that something is not developed, right? Not developed. And so that's how I want you guys to see your nursing careers. Like, you have this amazing gift that was handed to you, a blessing, but it is it's underdeveloped and it needs a lot of care and it's extremely delicate like a newborn. So when you think about a newborn, what do newborns require? If you have something that's immature and young and new, like your nursing career, what will it require from you as its mother, as its proverbial mother? What must you do to that thing, right? So what must you do? You got to feed it, right? You got to grow the baby. And Lord knows you got to discipline this thing or it will get out of control, right? It will get out of control. And for us who are parents or whoever are aunts or uncles, you know that having a baby in your possession is a lot of work. It is a lot of work. Babies require an inordinate amount of time. Your nursing career takes time from you. Right? When I talk about feeding it, I'm talking about investing in yourself, acquiring your knowledge. You don't have a baby that you never teach anything, never learns anything new. How far is that child going to go? So with your nursing career, you always have to be willing to put more into it. All right. Put more time into it. When I talk about feeding the baby, growing the baby, disciplining that baby, there are so many nurses out there who are totally undisciplined with their nursing career. They don't invest into it. They are working on skills that they had in nursing school. Even though they've been a nurse for 20 years, they have acquired no new skills. They have been an expert in nothing, right? And so I'm trying to get you guys to see that during this process, there is a purpose for everything that I'm requiring you to do with your nursing career. I have to be a role model for you guys. You guys know I'm in school right now. Do I have to be in school? No, but I do. I do because I want my baby to grow. I want my nursing career to flourish. I'm trying to get this PhD so nobody questions me. right? Like I want to be an authority in my field. And so like, for you guys, I want you to understand that this happens, right? You feed the baby, you grow the baby, you discipline the baby, and then guess what? The baby grows up and it takes care of you. That's what it's about, all right? It's about that nursing career in the end, being able to take care of you. Yes, you got to push the baby out. Y'all already did that, okay? Y'all already did that. Listen, you guys have this baby, all right? You need to understand that the more you invest into this child, the larger it will grow and it will be able to take care of you. That's the idea. That's tomorrow's result. But today requires you to do this, right? Today requires you to do this. And if you're a parent, you know that literally the grind of taking care of kids doesn't start until you get tired. You guys get that? When you wake up in the morning, you're full of energy and your kids need something. It's easy for you to do it. Let's go. Let's feed. Let's do breakfast. Let's get dressed. Let's do all the things you want to do. Let's play. It really feels like you become a parent when you're tired and your kid is requiring you to do more, right? So with newborns, it's not so bad during the day, but at 3 a.m. when you got to get up for that feeding, you feel it. And with nursing, with our nursing careers, it's the same thing. With our studying, it's the same thing. You don't start grinding until you're tired. That's when the grind begins, when you get tired. And so when you wake up in the morning and you're studying and you're refreshed, it's like, oh, I'm motivated. It's Monday. I'm motivated. But when Thursday comes or Friday comes and you're done with it, that's when the grinding begins. So I want us to have this perspective that our nursing career is a gift, it's a blessing, but it's really delicate, all right? It's really delicate and it requires you to put in an extensive amount of care and time, period. That's just the name of this game, all right? So with that being said, I need to move on because tomorrow's results are coming. I'm already in 2020. I'm waiting for you guys, all right? So all facts. We are also, listen, we're paying for NCLEX. It's a promise we made at the beginning of the year, and we are just fulfilling that promise. So we have 10 nursing students that we are paying for. Listen, if you know these people, let them know. All right. So these are the people. Marsha RN from the Bronx, and you guys are all getting emails that we have chosen you guys. Illumide RN from Houston, Mayol from Miami, Gordana. These are people who purchased the DVD package and we are investing back into them. Gwen Oak, Jacqueline, Brooklyn, Alexandria. Come on. What is that? Yep. Just Michigan. All right. Sashelle from Brooklyn. Mark picked all these students randomly, but it looks like everybody from Brooklyn or the Bronx. Johnny, Fort Lauderdale, got to represent Florida. Joanne from Pine Brook Pines, that's also in Florida. And Jennifer from Brooklyn. Brooklyn, stand up, ReMar nurses. All right. We are paying for you all because you invested in yourself. And that's all we want to do. That's all we want to do. I'm going to answer your questions here in a minute. So shout out to the ReMar nurses. I'm going to spend a couple minutes just answering questions because you guys have me here. And once I leave, I'm going back to 2020. I'll be waiting for y'all. All right. So the question that I see from YouTube is, will there be changes for NCLEX? Will the NCLEX test be harder in 2020? That's a great question. And the answer to that is no. The answer to that is no. The NCLEX is going to be the exact same difficulty level for 2020. All right. So, and what we do here is focus on knowing the content. We focus on knowing those topics. We're really comfortable with the information so that it doesn't matter what kind of questions they asked us. We know that all of the questions are going to be rooted into the subject matter, right? It's going to be rooted into the content. So that's the question that I answered. The NCLEX will not be any more difficult in 2020. All right. Any more difficult in 2020? What else do we got? What else do we have? Why was my name not mentioned? Oh, listen, Mark picked these. Mark picked them. I'm only the messenger. You can't shoot the messenger. But no, we're doing things all the way. We're doing things all the way into the year for you guys. We love to give back here. All right. Any other questions before I go? I'm not taking NCLEX till spring. Oh, well, in spring, we like to do, well, I don't know if it'll be this. All I can say is that we do ReMar Nurse University. And no, there is, okay, so disaster management is in the virtual trainer. I go over disaster management. All right. Any kind of like personal questions that you have, email them to me. All right. So these are just general questions. Anything special for those who already purchased the VT? Great question. So if you already have the virtual trainer, we have the rebate program for those who have purchased the DVD program. All right. So if you've already purchased the DVD program in the past or the online academy, you should only be paying $99 for the virtual trainer. That is the rebate. And the way you get it is what you need to do if you purchase, okay, just to be clear, okay, if you've purchased the DVD program or the online academy in the past and you have the virtual trainer, all you need to do is post a comparison video to the DVD program and the virtual trainer. What you like about it, what you liked about the other one, what you didn't like about it. That's what we're looking for. So once you post that to the Facebook page, we will refund you so that all you pay is $99 for the virtual trainer. Okay. So that's it. And okay, so anything, we don't have the DVD packages anymore for new sale. If you purchase the ultimate package, then you should have that program already. So somebody says, help me with HESIs. Thank you. Awesome. So somebody had the quick facts for HESI and it helped them pass. Perfect. For those who already have the VT, can one more month be added, please? I think we're going to try to look into see if that can be done retroactively, but I can't make any guarantees because if you understand how the virtual trainer works, it's a system. It is a complete system that has its own algorithms and its own programming. So when you get into that program and the subscription that you signed up for, that may be locked to your account and I can't do anything about everybody who purchased it. All right. But I know that I can make changes going forward. All right. Yes. If then you need the rebate, if you haven't done that comparison video, do the video and you will get the virtual trainer for just $99. Okay. All right. Somebody said, fair enough. Yes. All right. If you already have, okay, so that's a great question. If you already have the quick facts and you want to get the virtual trainer for $150, will it be less? The question to that is no. The $150 is the lowest price that the virtual trainer will ever be. Okay. So you will just end up getting another quick facts and you can give it away. You can, have one in the car, one at home, however you want to do it. Okay. 7 days of NCLEX starts December 26th through January 3rd for the sale, right, Mark? But the classes will run from December 26th through New Year's Day. Do we have a time on those classes yet, sir? 8:00 p.m. Eastern time. 8:00 p.m. Eastern time every day, I think, except for Friday, because you guys know we keep Sabbath. So the Friday class will be at probably 3:00. And New Year's Eve will be early too. But if you sign up for the event, we will send out the entire agenda for you guys. What is it? Oh, workbook. If you signed up, you haven't got your workbook, it's because that will be released December 20th this week. Okay, December 20th. Okay. If you don't have Facebook, listen, sign up for an account for the day, the period, post that video to Facebook. Okay. All right. So that's what we're asking for. And we've already had a lot of students who have done it. So we want to be fair to everybody. Everybody has to follow the same rules for this rebate to apply. There's no exceptions. Okay. So that's it. The time for it again, 8 p.m. Eastern time, except for the Friday after Christmas and then New Year's Day. We usually start the open house at noon. And the topics that I went over are there. But what I want to say about the topics is there are topics that I will be spending time on and lecturing, but there are a lot of other practice questions and homework for the 7 days of NCLEX. And so you'll get even more topics. You'll get even more topics throughout the 7 days because of the practice questions and the hot topics and things like that. So the topics that I see you guys requesting, I may go over them as well. Okay. All right. Team ReMar is taking your call. Somebody says, I appreciate you. The other companies never offer a sale, never offer a discount or free information. Hey, right on, sister. Right on, Joy. That's what I'm talking about. We're constantly trying to do things. And you know what? And we still don't make people happy. There's still people that are angry or upset with us or, something, but it doesn't matter because like what we're trying to just put out there is that if you have the best of intentions, if you're praying for people, then God is responsible for the results. And that's the truth about it. All right. So how long will each session last? That's a great question. The sessions are approximately about 40 to 45 minutes. So just really intense study sessions. And then I let you go, right? So just kind of like how we do for Let's Talk NCLEX, except for more detailed because you have an actual workbook. All right. The 7 days is free. The 7 days is free. Let me get you the website again for you guys to sign up for it right here. Check it out. You can sign up for 7 days right now. If you have not done so, please proceed. It's a free event. You're just signing up for it, putting in your name, putting in your email address so you can get that workbook. All right. Yes. This is happening. Somebody asked me, what am I doing for my PhD? My PhD is going to be in nursing education, of course, nursing education. So I will be focusing in on that. Right now, I'm doing like math and things like that. So, all right. So great question. Will the 7 days of NCLEX be on YouTube or Facebook? And I believe it is both. All right. There is no coupon code. The price will actually be, and we're working at it now, that the price will literally just be that price, $150, when you go to the website. So no coupon code needed. And Team ReMar is probably extremely grateful for that the price will be there. The workbook will be ready to print. December 20th. Somebody says, can you please change the time to accommodate those who work 11 to 7? I cannot change the time. I won't change the time, but I will leave it up so that you can watch it, right? So we usually leave it up for at least a week. So just in case you missed it. Okay. So even if you work, go ahead and go to work, be a safe nurse or whatever capacity you're working in. And then at the end, you can come home, eat breakfast, and study. So somebody says, Rosalie says, thank you, Regina. Mark, I passed NCLEX RN last week. I'm an international student, failed 4 times, used Hearst, Kaplan, Saunders. ReMar products is the best. Content helped me pass. Oh, Rosalie, thank you so much for coming on here. Yes, amazing. 4 times, international nurse. Oh my goodness. Thank you so much. Yolanda, thank you so much for participating. You're always all over the groups, and I appreciate your inspiration and your motivation. Okay. I brought the package in the online academy. How much can I get the VT for? $99, Etta. You got to do the rebate though. Okay. So this is the website. Somebody asked again. You just missed it. Yeah, that's okay. If you're just coming on, we're talking about the Black Friday sale that's coming up, bigger than Black Friday. I don't know why I keep calling it Black Friday. I'm forgetting the beginning of it. The bigger than Black Friday sale, where the virtual trainer will be $150 plus 90 days access. Somebody says, can you please explain further? So this means that you will get the new NCLEX review system. All right. You will get the virtual trainer workbook. You will get the quick facts book. and you will get access instantly. So how it works is when you purchase the VT, you get immediate access. You get right into the program. You guys help me out. You get right into the program and you can begin, getting comfortable with it, because it's like it's like some people say it's like going to school. It's like your own course. So you get comfortable with, your training center, your file vault. You get comfortable with all of the resources I put in there, the virtual trainer workbook, which comes to you a few days later, right? So while you're waiting for your books, there's a section that you can begin going over fundamentals called Before the Books Arise. Rose says, it's so amazing, right? So while you're waiting for these books, then you can do things like, do practice exams. You can watch a lecture. I have a sample lecture in there for you to get started, and just get really familiar so that by the time this book comes, by the time you get your VT workbook, you can begin watching the videos and get cracking with your NCLEX review. Because the actual NCLEX review needs this book. You cannot do the videos without this book. It's extremely hard. And so in here, this is kind of like the master book, because you have your, you have all of your homework. This is the clinical math that I added. I don't know if you guys can see it, but anyway, so this is the clinical math. And you have your practice exams, your homework, all is in this book. And so this is the VT. This is the virtual trainer. And this is the workbook that goes along with it. And I have one, this is the registered nurse, but I also have one for practical nurses as well. So this is an amazing program that I'm doing any and everything to get you guys in, because I want you to see the standard of nursing education. Like, it's so good. And it's Netflix for NCLEX. And I saw somebody else doing that, but literally I called this Netflix for NCLEX because the videos are so amazing, and they're so edutainment. What do we call it? Educational and entertainment together. So this is how it works. You get immediate access. So that means if you purchase it for the bigger than Black Friday sale, that means that you will get immediate access, plus you get 90 days. The program is only written to be 6 weeks. So that means you have an additional, what, 4 weeks? Yeah, you have an additional 6 weeks to just be in the virtual trainer, hanging out, making sure you complete everything, making sure you watch all the videos. I mean, this is like, I'm calling it no questions asked, because it wouldn't make sense if you did not do this. Like, this is literally the time that you do this, okay? End of the year, we're talking bigger than Black Friday sale right here at remarnurse.com. We've extended the access. We've made it better. Somebody says VT is so addictive. Yes, I know. And it can be frustrating at times. And that's one of the things about this virtual trainer, is that it literally calls for you to rise to the occasion, and it won't let you move on, and it won't let you progress. All of the homework, practice exams, before the books arrive, all of those activities, you have to get a 95% or greater in order to pass. You have to get a 99% or greater. And what I did is, every exam in the virtual trainer, I don't know if you guys know this, but every exam in the virtual trainer, I literally put in the book, so that once you took the test, so how I want you guys to do it, and this may clear up some confusion. How I want you guys to do it is, I want you to take the exam in your book first. So this is your assessment exam, your physiological assessment progress exam. I want you to take it in the book. And then when you're in the virtual trainer, you see these same questions, then that's when the virtual trainer will tell you if you got it right or not. All right. Because you won't find the answers in the book, they're in the virtual trainer. But the idea is that once you've taken this exam and you have figured out the answers, when you move on, you can always go back to this exam and you have it right there with you. So you don't have to make So you don't have to make like any additional trips inside the virtual trainer. Even when your access is finished, you still have all of your exam questions. And I did that intentional so that, you know, you always have everything that you saw in the VT for your training center with you. And that was kind of like one of the goals. Somebody says, do I need to do 2,000 questions in order to pass? No, we are not doing that. In 2020, in the future, I'm just telling you, because I'm already there, we are not doing 2,000 questions in the future to pass NCLEX. We're not doing it. Nope, 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 nope. We're getting rid of all of that myth, okay? All right, so let's see. Are you able to go back and repeat information in before the books arrive that you did not do well on? Can you repeat this information? Yes, actually, I don't know if you guys know this, but in your profile section in the VT, under your profile, you have the ability to reset yourself. So you can reset your entire program. You don't have to contact Team ReMar. If you want to start all over and do every progress exam over again, you can do that right there in your My Profile. Listen, in the virtual trainer, there's that video section called Getting Started. Go through those videos, because in every one of those videos, I tell you how to use every section of the virtual trainer, and there's so much in there for you to do. You can change the language, you can change, reset yourself, you can change your own password. It's your personalized NCLEX review. So take advantage of it. Take advantage of it. Use every advantage of that resource. You need to use it. And I'm so glad that you guys were in it. So once you receive the books, can you move on from the practice questions? Yes, once you receive the books, you can get out of the before the books arrive section is a place for you to study until your books arrive. So you're not just in the VT not doing anything. So that's it. All right, that's how it works. All right. Let's see here. What else? Okay. All right. So let's see. No, in order for you to get the VT for $99, this is how it works. You have to have purchased the product in the past, which most of you have, purchased a full program like the DVD program or the online academy. It can't just be like I purchased Quick Facts. It has to be a full program. And then you get the DVD. Then you get the VT program. And you do a video saying, this is what I liked about the virtual trainer. This is how it compares to the DVD program or the online academy. And then you post that video to, where do you post it? You post it to Facebook. And then you just send us a message and say, hey, I posted the video to Facebook. I'm ready for my rebate. And we give you the rebate, right? So with we're just trying, honestly, and I can keep saying this, but we're trying to make it so that you guys understand that, like, one of the things about the virtual trainer, you can take it everywhere. You can study whenever you want. If you want to put it on your tablet, if you want to put it on your cell phone, you guys saw the videos. They're really, they're done really well. The whole team did such a fantastic job making these videos great for learning, great for lecturing. It's me. It's brand new NCLEX review with myself, giving you everything that I've learned for the last 10 years on how to help nursing students. So when you're talking about the creator of the program, it's me, and I'm telling you that the very best of everything that I know and all the things that you guys have, shared with me experience-wise, I put in the virtual trainer. All right, put in the virtual trainer. So once again, before I get out of here, bigger than Black Friday, tell a friend. The virtual trainer will be $150, 90 days. Somebody says, if I need more time after the 90 days, can I purchase another? Yeah, there'll be a renewal fee for it for another 30 days, but you can. 90 days, that's it. It's written. And what I don't have, what I do have, do I have it? What I want to show you guys is also this. All right. And these are in the file vault of the virtual trainer. You guys have a lot of great resources and files that I uploaded. Shout out to the file vault. So in the file vault is also because it has every week. Okay. So every week that you're studying, it has what your plan will be for that week, how you're going to attack it. So for example, on Monday for the virtual trainer, it will tell you, okay, for example, If you get up at 8 in the morning, this is what you're doing from 8 to 8:45. Okay. And then from 8:45 to 9:30, this is what you're going to do. All right. And so this was a way for me to give you guys a minute by minute breakdown of what your study sessions should look like for the entire week. So there is no confusion. And again, these times are all variable. Like if you don't want to study at 8, if you want to make this 4, it's just an idea so that you at least know what subjects you should be studying. And this is why I truly believe that if you follow the calendar, you can get through this. You don't need 90 days. If you follow the calendar, you can get through this program in 6 weeks. So even you guys who have the 60 days, the program is 6 weeks. You have an additional 2 weeks, even on the back end of the VT. All right. So, this is just a way. All right. So somebody says, I will go over to the program now. Can I get the first shift instead of the 5-star quick facts with the virtual trainer? I have to think about that. I don't think so, though. The first shift and quick facts, they're not really interchangeable. But it's a thought and I will entertain it. All right. I still don't understand. I purchased the VT today. Is there any site I'm supposed to study before I get the products? Okay. So that's okay because this is all new to you. I understand that this is all new to you guys. I understand. So I'm okay with explaining it. All right. Okay. So this is how the virtual trainer works. So let me have the phone. So when you purchase the virtual trainer, Mark's phone. Okay. So when you purchase the virtual trainer, you'll get immediate access to the website. Okay, you'll get immediate access to the website, which means that when you complete your purchase, when you go to remarnurse.com and you select purchase the virtual trainer, okay, you will get immediate access to your NCLEX. your NCLEX virtual trainer. Okay, so you'll have all of your videos, you'll have all of your courses right here. So if you're a registered nurse, it'll say registered nurse here, and these will be your courses. And if you're a practical nurse, it'll say practical nurse. Okay. So when we say immediate access, this is what you're getting access to. Now there's sections in the virtual trainer. And so these are the sections that you get access to. And one section is called Before the Books Arrive. Another section is called Getting Started. So Before the Books Arrive is going to talk about like quizzes and things like that for you to do. Mark your phone. This is so terrible. People are seeing the cracks on your phone. Ignore Mark's phone. All right. There's another section called Getting Started. Okay. All right. So it's only a 6. And then there's a section called Virtual Trainer. And this is where all your videos are. So when you make the purchase and you get access to the virtual trainer, when you go into the VT, you don't have your books yet. These books are going to be mailed to you. So we created a place for you to study while you wait for your books. So that's why it's called Before the Books Arrive. So you would just go to the Before the Books Arrive. Let me select it. You would just go to Before the Books Arrive. Right. And this is all NCLEX preparation. And I'm doing this right from Mark's phone. And so we can see that Mark has done no work in Before the Books Arrive. But that's okay because there are plenty of activities for him to start. This is clinical terms. These are quizzes that you can do. All of these activities are there waiting for you to study them. Right. They're waiting for you to study them. And so this is what we talk about when we talk about on the go studying, when we talk about, you always have something to do in the virtual trainer. It's built for you to always have something to do. All right. So are you guys understanding more how it works? All right. So, okay. All right. So here we go. So this is what it's like. So then when your books come, you are able to go to the virtual training section of the VT. Okay. You're able to go to the virtual training section of the VT, which is this one here. And it says virtual trainer. Okay. And when you open up the virtual trainer house, then you are able to get all of your videos. You're able to get all of your videos. Okay. And so when I talk about the best of both worlds, the online academy had the videos, but they didn't have the books. So now with the VT, you get all of the new videos. Okay. And you have to do them in order. So you get all of the new videos and you get the books. So it's literally the best of both worlds with the VT. And that's what I wanted for you guys. I wanted, people ask, what's the difference between the two? Well, I mean, a lot. But in the end, it's for your benefit. So if you can, this is the time now that you should invest in the virtual trainer because the price is crazy low and it's an opportunity for you to get access to great information. It's an opportunity for you to get access to great information. And most importantly, pass NCLEX. You want to do everything that you can in order to pass this test because this is the biggest investment you'll ever make into yourself, period. Once you get your nursing license, it's all uphill. It's all uphill from there. All right. So that's it. So Butterfly Donald says, I passed mine on 12/12/19. And I use the DVDs. And is VT for RN or PN? It is for both. We have a virtual trainer for RN and one for PN, both. But congratulations, Butterfly O'Donnell. Thank you for that shout out. And yeah, it's the best. It's honestly, it's the best that I have to offer. If you love the DVD program, you will absolutely love the virtual trainer. Period. If you love the DVD program, and you will absolutely love the virtual trainer. So remarnurse.com, you guys, I'm going to get out of here. Thank you so much for spending time with me. I hope I answered your all of your questions as best as I could. If not, then you can catch me next Monday live. All right. Catch me next Monday live. 7 days of NCLEX as well starts next week. It starts next week. So don't wait for it. You want to have the workbook is coming out this week, the agenda. All right, everybody, have a wonderful day. Remember, this is what I like to say. I'm going to get to it. You guys know what we say here at ReMar Review. It's simply this. I can, I will, I must pass NCLEX. Don't forget, 7 days. It's coming, and I'm super excited about it. 7 days of NCLEX. I will see you guys later.